Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. This program focuses on healthcare issues relevant to you and your family. I've got a great guest on the show today, so I hope you'll stay tuned. Join us right after these messages. Welcome back to Your Health Matters. My guest today is Meredith Sena. Welcome, Meredith. It's great to have you on the show. Meredith, you're a physical therapist here at Kingman Regional Medical Center, right?
Yes.
And
yep.
you work in the physical therapy department, and that's a pretty broad area. I know it encompasses a lot. So what exactly do you do?
I am a staff physical therapist for our department,
Okay.
but the whole department is actually physical therapy, occupational therapy, and speech therapy. So I focus on physical therapy, which is helping people get back to walking, playing sports, get back to work after they've had an injury.
Okay. So now, how did you get that training to begin with?
I actually had gone to physical therapy in high school, and I decided that that was something that I wanted to do with my life. And so I went to school, and when I was in school, they didn't have a doctorate program like they have now. So I went to school for 5.5 years and got my master's degree. And then I just stuck with it, and I've been a therapist for 12 years now.
Oh, wow, very good. So now, where were you born and raised at? You said in school. So
Yeah, I was born and raised in New York,
Oh, okay.
and I went to school in Massachusetts, and to Springfield College in Springfield, Massachusetts.
Okay, and that's where you did. So was it a sports injury that got you into the...
It was. I was
Okay.
a swimmer, and I
Oh.
swam for many, many years, and I ended up having a rotator cuff repair
Oh.
done. And so I was in therapy for quite a while, probably
Right.
about 3 months. And I just kind of stayed on and shadowed my therapist for a while,
Oh,
and
great.
thought that that would be a great profession.
Absolutely, and I know you do a lot to help get people back into their normal life again.
Yes.
You know, being able to use those muscles and limbs that don't work quite like they used to before.
Yeah.
So what brought you to Kingman? How did you choose Kingman?
Well, I lived in New York until I was probably almost, in my late 20s,
Uh-huh.
and I got married, and my husband and I moved to really wasn't keen on the idea of leaving New York or Connecticut. All of
'Cause
our
your family
family
is
is
there,
there,
sure.
his family and mine. But the hospital had sent me a recruitment DVD.
Oh, okay.
It was a really cold day in Connecticut, and it was raining, and we were kind of sick of that weather,
Right.
Because that's pretty common back there. And so my husband dared me to apply, and so I did. And then Carol Tarquinio, who's our rehab director, had called me, and she's from Connecticut as well. And we started talking, and it seemed like it might be a nice fit. So she flew us out here for an interview, and things kind of just fell together. And we really liked it. We loved the mission of the hospital, and we liked the small town, and we love the weather here. So we decided to take a chance, and we're still here almost 4 years later.
I was just going to ask you, so it's been 4 years since you came, and Matt works for the hospital too, right?
Yes, he
So-
did it when we initially moved here, but about a year later he joined the hospital staff, and so it's
good.
really nice for both of us working here.
Very good.
Yeah.
That's great. It's good to have that team as
Yeah.
well.
Yeah.
Well, so the physical therapy, I know you do both. Physical therapy does outpatient and inpatient. Now, do you focus mostly on outpatient, or?
Yes, I do all outpatient.
Okay.
So there are occasional times when I help cover inpatient, but yeah, I've been doing outpatient. That was most of my career. I've been doing outpatient,
Okay.
and that's what I like. And maybe because that's where I started off as a patient,
Sure.
and I've always been into athletics and fitness, so that kind of suits me a little bit better.
Sure. And are those the types of?
Yeah, car
sometimes.
accidents, slip and fall, that kind of thing.
Okay.
yeah.
And the strokes? Do you work with the stroke victims
I
too?
do. It's not an emphasis that I have. We do have other therapists who focus more on that neurological area. I prefer have some crossover. Yeah.
Okay, so then when you're like a patient goes in to have orthopedic surgery done, like Dr. Ferrari, McElhaney, Dr. Allen, then they would do a referral to physical therapy after their surgeries to help get them using that joint or
Correct.
limb again, right?
Yep, correct.
Okay.
And so we would go through range of motion with them, getting their motion back, and then go through strength training, because it doesn't do you much good to have the motion if you can't use the arm.
Right,
So we'll
right.
use the strength, and we'll do some strength training, and then we get into more functional activities. So being able to reach up and wash your hair, or being able to walk to the mailbox, being able to do your job if you're still in the workforce.
Yeah, that's one of the things I think we don't appreciate our bodies until they don't work right. And
Yes.
then you realize how many times I lift my arm or move my leg or bend my knee, and you don't realize it because you just do
Yes.
it naturally until it hurts when you do it, or just doesn't do it, period.
I was working with an amputee actually yesterday, and he said the exact same thing. He said, I didn't realize it was so much work to walk, because he always used to just do it, and now that he has a prosthesis, it's a lot harder. It's like starting all over. So that's
you work
exactly.
with that too, and helping
I
them.
do, yeah. I have a
That's
few
gotta be-
patients right now that are amputees.
Well, and that's got to be really rewarding.
I
would think
do like that population, yeah.
To be able to see people going from having lost a limb or lost the ability to use it to then being able to function again. That's
Yeah.
awesome.
Yeah,
That's
I do like that. I like working with the
That's
amputees.
good. Now, what kind of things are you mostly here in the wellness center? Is that where your office is?
I was.
Okay.
When I started with the hospital, all of outpatient therapy services were at the wellness center. But just like the rest of the hospital, we have grown and grown and grown, and so we've needed more space. And so since I've been here, we have created a pediatric center, which is now located upstairs from the wellness center. And then we've also branched off in March. We opened a satellite clinic down the road on Wallapai Mountain Road.
Oh, that's right.
And I've joined that facility in July, so I've been over there since July.
And that's nice for those folks at that end of town. I mean, Kingman, of course, is still small enough that it's not like we have to travel hours to get somewhere. We're
true.
right here. But it's still, there is that population on the Wallapai, Rancho Santa Fe area that can then get their treatment right there, practically in their backyard. So
Yeah, and
it's
we've had a
really
great
nice.
response, and people have commented on that, how it's so close to their home. And then they also like that quieter atmosphere rather than the gym atmosphere, where others thrive on that camaraderie in the gym and the energy that the gym gives them. So
That's why you have an option.
exactly,
for
we're
both
able to
types.
offer people different options based on their personality, their injury, and their location.
Well, that's good. Now, here at the Wellness Center, I know they have the that pool. Do you use that some with some of the therapies as they first start?
I don't do aquatic therapy, but we
Okay.
do have two other therapists that do aquatic therapy.
Okay.
So if I have a patient that I think would benefit, then I would refer them to that one of those therapists for aquatics. Sometimes we do a combination. They'll see the aquatic therapist one day a week, and then they'll see me another day a week
okay.
to work on land exercises. But I know we're using the pool a lot right now, that
That's
we have
good.
two therapists that can do aquatics.
Oh, great. Right, that's good. I know that they've been, again, it's like you were talking about earlier, how much we're growing the hospital is, and they've been very successful at recruiting and bringing new healthcare professionals of all different areas here to Kingman, which is obviously a benefit for the community as well as for the hospital. And having those broader range of therapists that can meet the different needs is great.
Yeah,
So-
I've worked in a lot of places, and I would say this hospital has the broadest range of services as far as therapy is concerned out of all the places that I've worked at. And
that's good
all
to
of the
know.
therapists specialize in something different, and we all refer back and forth to each other to suit the patient's needs.
Okay, that's awesome. So if someone needed physical therapy, they've had surgery or they had an injury, whatever, do they need to get a referral from their primary care physician? How do they get into physical therapy?
It would depend. Usually in the case of surgery, it would be the surgeon that would refer them.
Okay.
But anybody can get it really from any of their providers.
Okay.
Just as long as they should make their other providers aware that they are going to therapy.
Sure.
And then they would just need a prescription stating their diagnosis, the reason why they need therapy, and then how many times a week and for how long the
Okay.
doctor wants them to come.
And sometimes they might need to even prompt the doctor and go, don't you think physical therapy might help me with whatever this injury is? And then, because a lot of times doctors obviously get busy and they may not even think of that as an option for them. So it
Correct.
doesn't hurt for people to be aware that we have that type of physical therapy available for them here.
That's true. And in the case of surgery, the doctor is usually pretty aware
Sure.
that they're going to need it. But in the other cases, like you said, then yes, it's perfectly okay for a patient to ask for therapy. And I don't think I've ever had a doctor say no, that you can't go. At least give it a try, and then if that's not the right avenue for you, you can try other things.
Sure.
But it's a nice conservative treatment.
It's a good place to start. And it is amazing how doing the different physical therapies can help those different muscles. Now, I know myself, I had like an Achilles issue for a while, and just doing the different exercises, I went, for a while through physical therapy, and then they gave me follow-up exercises to do afterwards, and took a while, and you had to keep with it. You can't just go, 1 or 2 times, and then I'm all better. No, not quite that easy.
And I think it's important for people to realize that it's not the therapist making you better, but it's the therapist teaching you how to make yourself better.
Right.
Of course, there are things that we will do for you that you can't do to yourself, but like you said, with the home exercises, your dedication to that and what you put into it is what you're going to get out of it.
Right. And that's true, and I think in all aspects of healthcare.
Yes.
It's very easy to maybe get lazy and just expect someone to wave a magic wand and we're going to be better. But unfortunately, we do all have to take responsibility for our own health and our own well-being, and take those steps necessary, whether it's to ask for the right treatment or to follow up and make sure we're doing it correct. Even things as simple as taking your medications that you're given until it's done.
Right.
A lot of times people take a few and then they're, I'm all better, so quit taking it. No, not quite. So the types of exercises, now, we talked about the therapy pool, but what other types of exercises do you use for strength training?
Well, over at Mountain View, we don't have a lot of the fancy equipment that you have here at the Wellness Center, but I kind of like that. I mean, I use TheraBands, which are elastic bands with resistance. I use different like pulley systems. We can use canes for range of motion exercises. So I like to focus, and I have little light hand weights for people to use and ankle weights. So I like to really focus on what the patient can do at home, and all of those things are relatively inexpensive, and those are things that if the patient doesn't already have them, they can borrow from friends for temporary use, or they can go to a store around town and get them for not a lot of money, like you would buy a big exercise machine. So for me, I actually like using all those little things because then I know that the patient has all the tools that they will need to continue their therapy when they're no longer coming to see me.
At home, and to do their own follow-up exercises. That's a good idea. And it does make it, I think, easier for people to follow their workout that you're prescribing.
Because they don't have to go somewhere and do it. It's all stuff that they can do at home.
Great, very good. Well, we're going to talk more both about the therapy and inpatient maybe as well. We'll touch on that a little bit and some of the other things that they do in physical therapy, and then maybe learn a little bit more about your interests and stuff too. We'll be right back after these messages. Stay tuned.